Hello and welcome to the Life-Changing Moments. Today, a videocast, usually a podcast. And the reason for this special videocast is that in honor of Physicians Week, we thought that the coaches at MD Coaches would have a conversation about the contemporary issues that are facing physicians in this moment and in history. And so we're going to have a roundtable discussion, and we hope that you'll find some things to respond to and that you'll be able to continue the dialogue even after we're done here, and so that we can continue this on in our Facebook site and our LinkedIn site as well. So I'm going to introduce our topic for the day, and then I'll introduce our panel, and then we'll get right into the discussion. So at this moment in time, medicine continues to evolve at an unprecedented pace. Innovation and evidence-based advancements are continuing to transform the way we diagnose, treat, and care for patients. With cutting-edge tools, deeper insights, and expanding possibilities, being a physician today offers more opportunities than ever to make a meaningful impact. However, we also find ourselves in a time when legislative mandates, ethical constraints, and systemic hurdles make it harder than ever for physicians to uphold their professional oath, leaving many to feel handcuffed in their ability to practice medicine in the way they know best serves their patients. So with that as an opening, I'd like to introduce our panel. All of us are coaches at MD Coaches. Dr. Carla Rodering, and just go ahead and wave as I introduce you. Dr. Mernal Shah, Dr. Deb Roman, Dr. Randy Cook, and our CEO and fearless leader, Rhonda Crow. So welcome, everybody. Thank you for being here for this conversation. So I just want to open this up as the moderator here. First of all, do you agree with what I said in the opening there, and especially that sort of the challenging part? And what are some of the most pressing examples that you've heard of or seen today?
I'll start with a thought and an observation. One, I do agree with this statement. I do think that practicing medicine now has taken on a whole new set of challenges for physicians that maybe 30 years ago I wouldn't have seen. An example that comes to my mind, there's one that's old and there's one that's new, and I'm sure my colleagues here would all be able to weigh in on both of them. The first one is the change from the paper dynamic, the opportunity to document your encounter in a more meaningful, straightforward way, and the move to a digital platform. While there's a lot of benefits to moving to a digital platform, I do think it creates a lot of barriers between doctors and patients. And I think that's one that has still created a bit of a challenge for physicians in practice today. And the second thing is, I think the pressure to overcome the value proposition for healthcare. It's becoming more expensive to practice medicine. It's becoming more dependent on either volume of patients or complexity of patients in order to create the value opportunity for a practice to stay sustainable. Many are choosing employment because of that shift. And I think ultimately what it does is it leads us towards a distance between doctors and patients, the joy that we choose to bring from our day-to-day practice. There's so many layers in between now that I think it's become harder.
Mernal, can I just ask you to expand on that last point? You said to overcome the issues that are creating the value-based care. Can you say more about that? What are some of those challenges that didn't used to be there?
To me, to be able to see the sheer volume of patients that it takes to meet your overhead constraints makes the doctor-patient interaction shorter, perhaps a little less personal sometimes. Patients come in with a certain expectation. Doctors have a different expectation of how that 10 or 15-minute visit may go, if you're even given the opportunity to have a 15-minute visit. So the value proposition, I think it's becoming more expensive to practice medicine. And in order to compensate for that, we sometimes just have to see more patients, and that makes it a lot harder.
Then the healthcare economics have shifted us in that direction.
And Dale, I really want to hasten to add that I think the reality of becoming an employed physician rather than an autonomous provider of service creates an entirely different dynamic. Previously, when the great majority of physicians were self-employed, there was no question that their duty and their loyalty was 100% for the patient. In the current environment, although you may wish to live by that standard, it simply has been invaded. You do have an overseer, and you have to think about the implications of what you do in terms of what your employer is going to think about it.
Yeah, I think you mentioned the legislative hurdles, and I think they're huge. There's so many laws that are being enacted now. I live in Idaho, and these laws are um, significantly impacting the ability of physicians to practice medicine in the way that we've been trained, um, and causing a tremendous amount of distress because there's confusion about how to move forward and still stay in alignment with some of these laws that are being enacted around the country. So that's a huge piece. I think, when you think about contemporary issues, I think that's something we're really facing in the last year or two that significantly changed how we practice and how we feel about practice.
Yeah. Deb, would you be okay sharing, just to get specific, because we're not all in Idaho, is there something that comes to mind as you think about an ethical or moral dilemma that didn't used to be there? An example of that, either yourself or a colleague?
Yeah, we have several laws that have been enacted. We have a very restrictive reproductive health law that makes it very confusing for people to determine how to practice. Um, there's also the risk of prosecution that is associated with these laws. So physicians are responding to something that's very different than we've ever had to think about. Um, there's laws that are being enacted to say whether we can treat anyone under the age of 18 without the uh, approval of their parents. And just as an example, something like that can be very distressing if a 17-year-old comes into the office and wants to be seen because they have depression and they want to be cared for. And if their depression is associated with an abusive parent, then the doctor is put in a very, very difficult position to decide how to move forward, and stay in alignment with the law and also help the patient. So I think it's causing a lot of distress for physicians these days.
As I'm sort of considering the comments of my peers and colleagues, what I hear and what I experience and what I witness is this marked distinction between what we were called to do, the commitment that we made, the nobility of the profession that has been in place since the beginning of healership, right? And our current environment, which is very not only complex, but often puts us at odds with the inner devotion that we have to doing good work on behalf of healing. However, you want to phrase that. And so what occurs, I think, sometimes for us is that we are in a constant state of competing intentions, if you will. We want to be compliant with regulation. We want to come into agreement with what the world outside of clinical medicine is asking of us. And we also want to be true to the profession, our oaths. I know that there's been a term called moral injury that we've spoken about that's in the literature that people speak to. I don't know what the right term is, but I do know that there's this inner experience of being at odds with ourselves, and with what regulates and imposes external requirements on a daily basis, and we like to be in alignment. You know, humans like to be in balance. We want to be in integrity. So that kind of inner milieu is really challenging for us to carry to work every single day. And part of, I think, what opens before us then is, given that this is how things are, how can we both individually and collectively make our way to a place where we can hold and manage and impact and influence what's unfolding before us in a positive way, both for our personal experience, on behalf of our profession at large, and certainly on behalf of our patients.
One of the things that keeps coming up, I know that we all work with healthcare professionals who are on some area of the continuum of thriving versus burnout. And one of the data points that has long been there, like even before burnout was a household term, was this sense of autonomy. I mean, when I was researching burnout years ago, the only thing that there was in the literature was, make sure that physicians at least have the perception that they have some control. And I like the way that you just framed that around, we like to be in alignment with what we are meant to do, what we're trained to do, not just what we're trained to do, but what we are called to do. And it's not as much about, I want to be in control, as much as it is about alignment. I love that. With that, I wanted to ask Rhonda, you, as head of MD Coaches, one of the things you do that none of us do is, first of all, you talk with all of us and you hear what we're seeing, what we're hearing, but you also get podcast guests and you listen to all the podcasts. And so more than any of us, you are collecting themes and collecting a sense of what's going on out there. And I just curious what's happening in your mind right now as we're talking about this.
Yeah, that's actually a really good way to put it. And it has been kind of a long-term research, if you will. What it has done for me is it has affirmed what prompted me to move forward with bringing this collection of coaches together to continue to bring your perspective with me. But what I hear is I hear the misalignment, and I hear a sense of not feeling valued. Just lots of almost screaming into an abyss, but not being heard. And I know that sounds very dramatic, but it's what I hear. It's what I see. That's it's appealing certainly to my empathy. And how can we take the smartest people in the room many times and help them feel not only valued, but heard and empowered? That's what I'm hearing. We we have legislation that's being developed to impact and affect your work, but are you being asked for your input? Are you being asked for what the outcome is going to be? Are you being asked to provide the scenarios and help create the solution? I'm not seeing that. And I think that's where a lot of this rub is. So that's, from my seat, that's what I'm hearing to answer your question, Dale.
Yeah. We are going to shift a little bit into what are some things that we're hearing that may be some movement in a more positive direction in just a little bit. But before we get to that, I'm interested to hear from all of us, some of the external factors that we're talking about here are intended to be in service of meeting the challenges that Murnal, I think, pointed out with this shift towards the way the healthcare economics is going, to figure out a way to still do some sense of quality care that's in an evidence-based way that can still keep the lights on. Can we still do all that in some ways? And so there's economies of scale, and there's, you have to see more people and all that. We don't like it. We don't like not having as much time as we feel is important to have with patients. My question for all of us is, what are you hearing about the impact that this has, that a lot of these changes have had on actual patients? Now, I know all of us have had family members who've had to access the healthcare system, and we've accompanied them there. So as a family member, as a person who's hearing patient stories, what are you seeing?
I think that's such a great question. I would offer that from my perspective in working with patients, many of them are equally frustrated. They don't have time with physicians. They don't feel, as you said, Rhonda, they often do not feel heard. They don't feel like there's enough time for them to be heard. And so they feel very often in a situation where somebody has 10 to 15 minutes, if that, with them, they are not able to navigate their healthcare appropriately. And many of them, I think, seek advocates to help them do that, which is very interesting because I think the physician always used to be the advocate, or still is in some cases, right? But that's part of our role, is that we help guide people and accompany them through this process. But many of them are coming to me to say, there's no time. Like, I had a patient come the other day that said she started the conversation with her physician by saying, how much time are you going to be able to give me today? Knowing that she had to decide what was going to be most important to her to address. That's a big piece.
You just gave me chills, Deb. You just gave me chills with that. Remembering I have some very close family members that I recently lost due to some extended illness. And I've just been flooded with memories of going in for visits and listening to, at the conclusion, my sister is one of those that I lost, feeling abandoned, feeling alone in a very scary diagnosis, and wondering, what do I need to do to navigate a very complex system? I have a bit of knowledge, but not all the knowledge that I need. And I'm ill. I'm severely ill. And so more and more, this is the norm story. This is not an exception. And she's one example of many stories I've heard like this. And this was not the story I heard early in my career. So there's a sense of feeling abandoned. And I think it's also coming out in ineffective coping skills when they do access care. One of the topics that is very concerning for by the bedside caregivers is violence and being mistreated themselves. And I think we have to step back and take a look, well, what is underlying the behavior and what's adding to the behavior? And it's part of the system that they're trying to navigate. So that's what you just brought to my mind with that question, Dale, and with that thought, Deb.
I think, as this group knows, but I'll share it for our listeners, my mom was diagnosed with a grade 4 glioblastoma about 2 years ago. Actually, we're going on 2 years now, which, the diagnosis of grade 4 glioblastoma, and the fact that that was 2 years ago in and of itself is pretty astounding. I learned a lot by watching what her journey was like through healthcare. And in many ways, sometimes through the lens of what I will consider healthcare privilege because I'm a doctor at that hospital, the thing that really stood out to me was how many of my colleagues almost appreciated the reminder that my mom gave them about why they went into medicine. So what I was thinking of as a huge favor to me and how grateful I was for the care that they were providing, and I felt like they were all going above and beyond to take care of her, and they were, each one of them almost across the board almost thanked me for the opportunity because it kind of was that reminder for them about why they do what they do. I guess the physicians benefit probably just as much then when they have the opportunity to interact with patients in a way that patients need us to interact with them in. It's better for both of us in the process. And it leads me to just one other concept I wanted to share with the group and to our listeners. I teach residents still, and one of the things that comes up is good medicine, being a good doctor, and best practices. And sometimes we throw those around like they're kind of the same, but I don't think they are. I think good medicine is what all of our patients are expecting us to give them. We all went to med school. We all, are board certified. We're all doing what we're supposed to be doing. Good medicine is what we should all be doing. But being a good doctor is not assumed. Being a good doctor goes well beyond good medicine. It goes into the interaction, the relationship, the trust, the ability to listen and hear and appreciate and understand where patients are coming from. Some do it better than others, but that connection is really important. So the difference between good medicine and being a good doctor. And then best practices, I think, almost goes to the other extreme, which sometimes feels a little bit like trying to be the best practice in absolutely everything that you're doing might create a situation where you're actually having a hard time doing anything the way that you want to do it. I always find myself challenging with how do I make, being a good doctor above that of being good medicine, and how do I find those best practices that are actually going to be meaningful for the patient's outcomes? It gets harder and harder as the body of medicine gets more and more complex. So those a couple of thoughts, Dale.
I'm glad you mentioned residents, and I'm still involved in teaching residents as well. And I know we've talked about this before as a group. And Randy, you may have been the one that pointed this out to me, but if it wasn't you, I know we talked about it. This recent statistic about current medical students, the percentage of them that are not planning to do full-time clinical practice. And I believe it's about 50%. It's as high as 50% of current medical students. And it doesn't mean that they're not going to do no clinical practice, but when we all went to med school, I mean, there may have been a few that were going to go do research, but everybody was, and maybe some academics, but everybody was heading into practice. So that's got to have an impact. And so there's a couple of ways to look at that is what's going on that either created that, and then also what impact might that have a few years from now? What are some of your thoughts?
The thing that I understand the least about current physicians in America, I don't understand why that even enters your head, that I should be looking for a side gig or whatever you may choose to call it. I just don't understand it. During the course of my practice, it never entered my head that I would do anything other than bedside care. And of course, there are other things that would have been equally as rewarding, research, whatever. But for me, it was bedside care. For others, it's other things. But why you would want to do something else other than medical care just absolutely astounds me. And I don't know if it has something to do with the mindset of the modern day medical student, or something about the practice environment that makes you feel like you need to step away from it from time to time. I wish somebody would write a book about it to help me understand it, because it just doesn't make any sense.
I think that it really speaks to what we've been talking about. Manara, you mentioned, the relationship that we have with patients and how we are nourished when they are nourished, right? There's a circle, right? And many of us are old enough to have experienced a time where we did have more time and we could spend more time listening and asking patients, what do you think is going on? And taking the time to help them navigate what they were going through. And that nourished us. And many of the young people coming up that are working, and seeing so many people in a day, they're dealing with all of these other external forces. And, we haven't mentioned kind of like the politicalization of medicine. That's a whole nother aspect, or some of the ways that physicians have been viewed since COVID, another thing that many of them have lived through, right? But importantly, I think they haven't had the chance yet to experience how wonderful it is to work with a patient where you really feel like you can sit and create that space for them and learn from each other about how to help them move forward, you know? And so that is the piece that really allows us to work, long, long hours and push ourselves, to really do this work, because it's the beautiful part of the work. I work with residents too, like Dale does, and they'll express to me that, they're trying to see so many people and deal with so many complicated things and then write these notes. And they don't have that chance sometimes to sit down and see what it is, like you said, Mernal, for a patient like your mom to say, I'm so grateful that you're here. And, tell me why you did this, or whatever it is, that makes it really very worthwhile.
As I look back at my own training, that I have an incredible admiration for my mentor. That I was kind of I mean, it was almost like a mentorship or apprenticeship, right? And my attending physicians, my teachers, my guides loved being in medicine. We were rushed. Things were urgent. It was busy. People were sick. But there was this sort of shared feeling that we all showed up. We loved this profession that we chose. We were willing to lay down what we needed to lay down on behalf of this good work. I think about people now who witness us and some of the folks who are showing up as attendings and clinicians every day, and the predominant experience is, how much longer do I have to do this before I can leave? Right? So the messaging that we're really delivering to folks who are beginning in medicine or working their way through that first decade is substantially different than the one I received. The invitation into a future is an entirely different kind of future. And so I suspect that there is a way to kind of proactively preserve our energy stores, our whatever it is that we feel we will lose walking into that experience, um, by saying, yeah, I'll do this, but not all the time, right? Not all the time, because I see the cost of it and I'm not willing to pay that price. I don't know that that's true. That's just kind of my personal observation, um, maybe based on what I would have thought if I had witnessed that. So I think that it's, again, I think it's really complex. I think that And if I might just say this last thing, is there has been kind of an exodus of wisdom leaders, of elders, of mentors who have either left medicine altogether or moved into, you know, non-clinical roles um, for the sake of their own lifestyles or well-being, whatever. And so the workforce, the nature of the workforce, doesn't contain as many, you know, kind of season. For me, it would be that doesn't contain as many crones, right? But those seasoned voices that can help us navigate the hard stuff.
I think some of us are those seasoned voices. Rhonda, were you going to say something?
Yeah, and maybe it's a little more simplistic view, but this has been an evolution. When I started my work in healthcare, the majority of physicians were independent practice. They were independent practitioners. And I've watched during the course of my professional journey a migration to the majority now are employed physicians. And I just feel that with an employed mentality, it's really been more of a clock in, a clock out kind of thought process. That what comes naturally with that is looking at side gigs, because you're kind of packaging that thought process, and I'm just wondering if there is some correlation between that evolution and seeing a rise in, I'm going to invest in a medical degree and that knowledge base, and then how can I elsewhere besides direct care utilize that?
Yeah, I think
that's what's in my mind.
Yeah, I think most of us would agree that there is a line between that exodus or the feeling like I don't want to be in this uncomfortable kind of a place. Well, I'd like to shift, if we could, shift the energy, and if we have the energy to be able to shift. And we're coaches, and it's important in coaching to acknowledge a client, and the client could be a group or an individual. Important to acknowledge where they are. If they're in pain, we acknowledge the pain. If they're struggling, we acknowledge the struggling. And coaching is also about forward movement. It's also about how do we move, how do we go in a direction that, and I'm going to use Carla's language, that's more aligned with ourselves. How do we do that? So we've done spent the most of the time so far acknowledging the pain and acknowledging the suffering. What are some stories that we have amongst us that is somewhat hopeful about some movement in a different direction that does serve people to be able to work in alignment with their values?
While the group's maybe thinking about some of your clients that you've had, I just had a conversation this morning that reiterated something that I've seen with many clients over this period of time. The world around us is always changing. The people we work with, the state of the union, how things are going, what decisions are being made, who owns the practice you're in, who owns the hospital, all those things are changing. What I am finding is that we do have more control over our radius around us than we realize. And I think coaching is an opportunity for us to help people find where could they own more of their environment, help make more of the decisions that are going to matter or be meaningful to their day than they realize. And maybe there are decisions that maybe we do get caught up in that we feel disempowered by, that we're spending an inordinate amount of time dealing with. Those are all very vague. Let me try to get specific. Client that I was working with really thought about maybe it was just time to get out of medicine altogether. He's kind of a young guy, but found that medicine wasn't turning out to be the way that he thought it was going to be. And in our sessions, we started talking about all the things that were frustrating for him, kind of like what we were all able to articulate that we're hearing is kind of challenging in medicine these days. And what I found interesting is that he was focusing in on things like the RVU generation report that he gets and how upsetting that is to him, or how he doesn't have the autonomy to choose this type of material versus that type of material when he's in the OR, like he used to when he was in an independent practice. Or, you know, maybe even how he schedules his patients and how he schedules his operative day. But what we found through the process of our coaching work is that there were things that he could pay attention to and help make decisions around that could, in fact, actually make his day better. And he started implementing changes one after the next. He actually had more autonomy on his schedule than he realized. How could he arrange his schedule in such a way that the flow of his day would run differently? And that really helped him a lot. And then how does he process patients when they come in with an initial complaint? How does he leverage the rest of his staff to help him maybe not feel like he's having to do everything, but maybe this person can do A, this person can do B. That leaves him time to do C, but he figured out how to use his day in a different way. And by the end of our work, he actually found that he felt like he was spending more quality time with his patients and actually watching his day flow in a better way. That not only did he decide not to leave the practice of medicine, but actually found that he was having fun doing it again. You know, I check in with him periodically. That was about 8 months ago, and he's still enjoying what he's doing. So I hope that some of the changes that he was able to implement were things that could stick around and help him enjoy being a doctor. It also reminds me, though, that as a coach, one of the things that we all believe in is that the answer lies within the client. It's not something that I could advise him to do or tell him to think differently about. He actually knew the answer. It was just a matter of asking some of the right questions so that he could think about it. And he came up with his own plan and his own solution. And he's the one kind of, I think, reaping the benefits at this point, Dale.
Yeah, that's a beautiful story. That's a wonderful thing to hear about. I had a similar thing happen yesterday. I met with a resident, and we spent much of the time, like we did here today, talking about all the constraints and all the things that were not working for her. And then she was thinking about what her next steps would be, who she would go into practice with. And it was such an interesting conversation because again, like you say, Manal, we just ask questions, right? As coaches, we really just reflect things back. And the conversation turned as you brought us around, Dale, to say, what would it look like if you could find that practice that really would nourish your soul, that would make you feel so like this is what I want to do in my life, right? And and we spent some time with that. And then she sort of mentioned in passing this one interaction that she had with one of her preceptors, who it does primarily geriatric work, and she wants to do family practice. But we somehow, came back to that conversation, like, where, like you said, Carla, where are the places of alignment with her values? And there were so many between her and this particular physician that we started to explore together. Well, could you do that? Start there. And what are the opportunities for you to even expand that into primary practice? And she left so hopeful that, maybe there was an opportunity for her not to have to constrain herself into a practice that did not meet, her expectations. And then she called me last night and she was so excited. She had talked to the doctor and it was even better than she thought. And they had all these wonderful plans about how they could work together. The physician was super excited to have her on board. And it was just this beautiful process. And again, to your point, Mernal, she knew that inside. I didn't have that answer for her, but she kind of brought it up and we sort of gave it a little bit of light and she found her way with it. There are ways, right? It's beautiful.
I think, and I want to hear other stories too, but one of the things that this brings to mind Dyke Drummond, who's also a physician coach and a Happy MD website, recently wrote an essay about how residency training trains us to be residents. It doesn't really train us well to be practicing physicians. And one of his arguments in there was we learn how to follow orders, and we learn how to be good team members, and we learn how to just do what we're told to do. And we don't really get to practice agency. And so one of the things that simply what triggered when you were just talking, Deb, is I also do career coaching with residents. And one of the things almost every one of them says is, I'm just going to go work for the system. And there's this expectation I have to do what they say that I'm supposed to do. And then the question is what do you want to do? So if we walk into systems with this sense that I have to do what the job description says, I'm not saying that everybody has to be rebellious, but we really need to be part of co-creating that still. We still need to be part of co-creating. And my experience is very similar to what you said, Mernal. Once clients regain this sense of agency and they ask for what they want, they don't get everything they want, but they get a lot more than this sense of, I'm not going to get what I want here because I'm just working for the system. So there is this sense that we've kind of lost that I think that our job as coaches is to help people regain this sense of, you can ask for what's going to help you align better with what you want. And you may not get it. And if you don't get it, go find another place that you can find that. But most of the folks I've worked with, once they asked, they generally got it. They generally got it. So it's interesting that we've lost that perspective that we can ask, but I think it's because we become employees and we're not self-employed. Randy?
I want to mention one other thing that has kind of fascinated me about people that I have interviewed on my podcast, and that is that quite a number of people who became not only successful but very satisfied in their medical career were people who had incredible challenges on the way to getting there. We in the United States most of us enjoy a lifestyle where real challenges are relatively rare. And the people that I'm talking about are, I had a couple of podcast guests that escaped from Vietnam on the skids of helicopters and that sort of thing. One young man a Lebanese young man was able to escape the war there, landed in New York City with about $5 in his pocket and couldn't speak a word of English. Went on to become a very successful cardiologist and inventor of interventional tools for cardiologists. And I could go on and on. Well, my point is that one thing that I think coaching might offer is to help people get in touch with why they ever even thought about becoming a physician and where the target is for where your own sense of self-fulfillment is, and finding ways to understand exactly what a difference you can make, not only in your own life but in the lives of so many people, and not so much just for the patients, for the community that you live in, for organizations that you're part of, and so forth and so on. But there's something to be said, I think, for having had the experience of great difficulty. And if you haven't had the good fortune to face great difficulty, maybe a coach could help you understand exactly how fortunate you are and where the opportunities are for you to enrich your life and enrich the lives of others.
I've been listening to everyone, and I think that there's great hope, right? for the evolution of our profession in a really positive and more healthy way. And that one of the things I noticed is that there's an expanding awareness that the well-being of the people of medicine matter. And that there may not necessarily be, good tools at the tip of your fingers, but more and more there's a recognition that when we can't give what we don't have, right? We can't that we can't serve from an empty cup, all of that stuff. So there really is a growing awareness that something is afoot and we need to do something about that. Something's afoot with our medical people and we need to do something about that. And there's something that we're doing that could shift, make a difference. So I think there is that piece. And the other piece from more of a kind of a personal perspective, the kind of conversations we have in the context of coaching conversations or just peer conversations is we kind of live in the experience of our thinking, right? So something happens, I have a thought about it, I have a feeling about it, I live in the feeling of that thought, and that is under our dominion. So if I notice where I'm placing my time and attention, if I'm placing my time and attention on how unfair this is, how intolerable this is, how pressed I feel, how there's no end to the urgency, how tired I am of, I'm going to live in the feeling of that. This is more than just a positive psychology. It is taking a look at our thinking on behalf of our own well-being. And so can I actually spend 5 minutes of a busy day reflecting on things that warm my heart? Can I spend a couple of minutes saying, I am so grateful that happened? Can I spend a few minutes saying, this is really frustrating and what an incredible privilege for me to stand beside this person in their most vulnerable moments? Can I spend a moment saying, I am not helpless. I am an empowered member of the healthcare delivery team. And when I work arm in arm, shoulder to shoulder with my peers and colleagues, we become even more empowered and can make an even more profound difference. So there's opportunity for us to look in directions that we don't spend most of our time. If we're going to fantasize, we might as well fantasize positively, right? Right. And really sort of doing a self-experiment. Experiment. How do I actually feel if I spend this little piece of my time reflecting on the goodness, remembering the goodness, remembering the calling, remembering the moments that keep me coming back day after day after day?
As usual, after Carla speaks, there's really nothing to say. Really want to just hold that, what you said, Carla. It encapsulates a lot of what we are after as we bring some of this, our work, to our colleagues. But as we reflect on this whole conversation about how easy it is to get mired down in the challenge and the change, and how easy it is to forget, as you said before, the alignment, what's positive for us. And so I really invite us all to put into practice what you're suggesting. In coaching, we work with individuals and with groups. We are aware that there are some things that are being attended to on larger levels to make some changes, systemically. And we didn't talk too much about those today, but we are aware that there's attention being paid to that on some very high levels. I know Mernal's aware of a lot of that as well. But I just want us to, I want to close us out by saying thank you all. And, one of the things that came up for me, Carla, as you were talking about, gratitude and what we appreciate. I appreciate all of you, and I appreciate the opportunity to be with you all weekly when we meet, but also these really generative conversations that allow me to take this energy out into the world as well. And so my hope for the listeners and viewers is they also will practice some of what we've said, some small piece of it, and also bring that to themselves as well as to those that they work with. So with that, I will say thank you, and thank you to the listeners and observers and the viewers, and be well.